Welcome to part 2 of this 4-part continuing education series. My name is Max Dodge and I'm a paramedic in New Hampshire and an EMS instructor. This 4-part series of short continuing education topics will cover airway, respiration, and ventilation portion of the National Continuing Competency Program topics. So let's get started with our second problem. We know that we can calculate the amount of air that a patient breathes in a minute by multiplying their respiratory rate by how much air they breathe with each respiration. But how do we determine if the amount of air they're getting is actually enough? First, let's take a look at how we define breathing. We have names for all of the various amounts of air that we move in and out of our lungs. This graph is known as a spirogram, and it shows the divisions of lung volume. So let's go over what we're looking at here, and then we'll dig into how it all relates to our job. So up the side of the chart there, we have the total volume of air that can be held in the lungs, which for, again, a healthy, normal-sized, 70 kilogram, 180 pound adult male is around 6 liters at the tippy top of the deepest breath that they can possibly take. In the middle, we have that red line indicating the flow of air in and out of the lungs. When we're breathing normally, we see that it goes up from just above 3 to around 4. And again, this is relative to the person. This is known as our tidal volume, and this can be written as VT. When you think of tidal, think of oceans rolling in and out. That's what air is doing. When we take a deep breath, we're extending into what we call the inspiratory reserve volume. This isn't an area that we use very often, and it's usually only when we're doing strenuous work or if we take a deep breath in or we sigh. Now, everyone watching, let's do an experiment. Everyone hold one finger out in front of you. This is our imaginary birthday candle. Now, gently breathe all the way out, making sure that you don't blow out the candle. Now, blow out the candle. How did you do that? How did you breathe all the way out and still have enough air left in your lungs in order to blow out the candle? Well, you dipped into what's known as your expiratory reserve volume, or the amount of air that's left in the compressible areas of your lungs. But did we get every last molecule of air out of your chest when we did that? No, we did not. We still have a couple liters of air in there. This is called the residual volume, and it lives in the area of the lungs that we call the dead space. We can't get rid of the air in this dead space because of the cartilage that surrounds our trachea, bronchi, and bronchioles. These passages are always open and will always have air in them unless you get crushed by a bus or something. So if we have residual volume in the dead space that isn't useful to us, what do we call the part that is useful? Well, this part's called the vital capacity. And this is the total volume of air between when you breathe all the way out and when you take the deepest breath you can possibly manage. Okay. The first thing we have to note here is that the actual volume of air that a person breathes is based on the size of their chest cavity and the structure of their lungs. So shorter people have less vital capacity than taller people, and biological females have less vital capacity than biological males, even if they're the same height and weight. So we use calculations based on something called ideal body weight, or IBW, to figure all this out. An IBW is based on a person's height, not their actual weight. Most providers who need to calculate values based on IBW will use a reference chart to do it, so don't feel bad about using references. The next thing that's important to realize is the relationship between tidal volume and your vital capacity. So again, when we're breathing normally, we see that the red line goes up and down in a relatively narrow range. A normal breath has a tidal volume that's only a small proportion of the total volume that can be breathed in and out, around 10% of the vital capacity. Even during hard exercise, the tidal volume only increases to about 50 or 60% of your vital capacity. We almost never reach the top or bottommost extremes of our vital capacity. So how do we apply this to what we do? Well, one of the things that we're expected to do very early on in our assessment of a patient, in fact, during our primary survey is to assess our patient's breathing. Now, most folks will do this by looking at the rate and depth of breathing. We know that rapid and deep is bad, but slow and shallow is worse. We also know that tidal volume times respiratory rate equals our minute volume. If we're going to slap some metrics on this, we'd be looking at respiratory rate and tidal volume. If we map out our normal physiological values for respiratory rate and tidal volume, it gives us a general target to shoot for in terms of our minute volume. But we also know from part 1 that this patient can take in as much as 8 liters of air in a minute during hard exercise. So if we do some math and we divide 8 liters by the respiratory rate, we get this orange line showing up. And this shows us what our tidal volume should be on the high end. This is the amount of air we'd need to breathe if our respiratory rate, or the amount of air that we would need to breathe if our respiratory rate were 4 a minute in order to be close to this curve would be 2 liters, which is a massive amount of air. On the other hand, we know that our resting patient is taking in around 5 liters of air per minute. If we do the same math, we get this second yellow curve. Like before, if our respiratory rate were 50, we'd be breathing in 100 milliliters of air with each breath. There's more than 100 milliliters of air in your trachea, so your lungs would never see a new molecule of oxygen. But now we can see we have a sweet spot for our ventilation. This is where our adequate minute volume lives. And now we can see why the normal physiological respiratory rates are what they are. If you're too extreme to the left, and you're needing to deliver more air than will fit in the lungs without damaging them. If you're too extreme to the right, then you're not giving enough air to get through the dead space. If you're too far up, then you're doing bad things to blood chemistry and pH. And if you're too far down, you're starving your patient for air. So how does this apply to our practice in the field? Well, let me ask you this. How much air can the bag of a BVM hold? Most BVM reservoirs contain between 1,200 and 2,000 milliliters of volume, depending on the manufacturer. So I'll ask another question. What is the tendency in terms of volume when we bag patients during an emergency? Well, one study took a look at the average volumes delivered by trained healthcare providers using a standard adult BVM. The amount that they were delivering was over 800 milliliters for each breath. For reference, the suggested volume for a lung protective ventilation for an 80 kilogram adult male patient is only 480 milliliters. And just as an aside, the lung protective ventilation refers to using appropriate tidal volumes and respiratory rates in conjunction with positive and expiratory pressure devices to reduce the ventilation-associated lung injury. And we can calculate the desired tidal volume by multiplying the ideal body weight of the patient by 6 milliliters. Now, I'm sure folks have heard about using a pediatric BVM on an adult patient to lower the amount of air being delivered during ventilation. Well, the previous study that I talked about took a look at this too, and found that these same trained medical providers were still somehow giving 630 milliliters of air with each breath. They must have been literally crushing those tiny bags. Now, I think the point here is that we can see how BVMs can very quickly injure our patients if we're not being careful. So we need to only squeeze about a third of the bag or squeeze to chest rise when we're using BVMs. So to recap, in this part, we took a look at a spirogram and got a sense for how much air is in your lungs. We talked about ideal body weight as a way to calculate appropriate tidal volume, and we looked at the sweet spot for achieving adequate minute volumes. Check out the next part where we're going to discuss the terrifying progression from respiratory distress into respiratory arrest.